Do you know what a urinary tract infection is? It's a common term, but not everyone is aware of what it truly entails. Urinary tract infections, frequently abbreviated as UTIs, are essentially invasions led by bacteria into the urinary system. This system, designed to eliminate waste and regulate our body's water and salt balance, becomes a battleground where these microscopic invaders unleash an infection. UTIs can occur anywhere within this system, from the kidneys that filter our blood to the bladder that stores our urine, the ureters that connect them, or the urethra where the urine finally exits. Any part of this intricate system can fall victim to a UTI, disrupting the smooth functioning of our body's waste disposal and regulation mechanism. So that's a brief overview of what a UTI is. Now let's delve deeper into the causes. It's important to understand these causes, as it can help us better manage and even prevent UTIs in the future. Ever wondered what causes a urinary tract infection? Well, let's dive into it. Urinary tract infections, or UTIs for short, are primarily caused by bacteria that enter the urinary system. The most common culprit is a type of bacteria known as Escherichia coli, or E. coli, which usually live harmlessly in our intestines. But when these bacteria get into the urinary tract, they can cause a whole lot of trouble. So how do these bacteria get in there? Often, they enter through the urethra, the tube through which urine leaves your body. From there, they can travel up into the bladder, and if the infection isn't treated promptly, it can continue its journey upwards, reaching the kidneys. And trust me, a kidney infection is something you definitely want to avoid. Now, while anyone can get a UTI, certain factors can increase your risk. Let's talk about a few of those. First up, sexual activity. This can introduce bacteria into the urinary tract, especially in women, whose urethra is closer to the anus, where E. coli resides. Certain types of birth control, like diaphragms or spermicidal agents, can also increase the risk of UTIs. But it's not just about sex. The risk of UTIs also increases with age, particularly for women. After menopause, the decrease in estrogen can cause changes in the urinary tract that make it more susceptible to infection. And let's not forget about conditions that block the urinary tract. Things like kidney stones or an enlarged prostate can slow the flow of urine, giving bacteria more time to grow. So while it's clear that bacteria are the main villains in the UTI story, they're not working alone. They're aided by a number of factors that can increase your risk of getting a UTI. Understanding the causes helps us better prevent UTIs, but how do we know if we've got one? So, what are the telltale signs of a UTI? If you're wondering, you're in the right place. Urinary tract infections, or UTIs, can manifest in a number of ways, and understanding these symptoms can help you identify the problem early and seek timely treatment. The most common symptom of a UTI is a burning sensation during urination. It's not just uncomfortable, it's a red flag that something's not right. This discomfort is caused by bacteria in the urinary tract, which irritate the lining and cause inflammation. Another symptom you may notice is the frequent urge to urinate. You might feel like you need to go all the time, even if you've just been. This is because the bacteria are stimulating the nerves in your bladder, making it feel fuller than it actually is. Now let's talk about your urine. Changes in the appearance or smell of your urine can also indicate a UTI. If your urine is cloudy, or if it has a strong, unpleasant smell, it might be time to get checked out. These changes can be the result of bacteria and white blood cells in the urine, which are your body's response to infection. Lower abdominal pain is another sign of a UTI. This discomfort can range from a dull ache to a sharp, stabbing pain. It's caused by the inflammation and irritation in the bladder and surrounding areas. In some cases, if left untreated, UTIs can lead to serious complications. These can include kidney infections, which can cause high fever, chills, nausea, vomiting, and upper back and side pain. These symptoms should not be ignored, as they can indicate a severe infection that requires immediate medical attention. It's important to remember that not everyone with a UTI will experience all these symptoms. Some people might only have one or two, while others might not have any noticeable symptoms at all. This is why it's so crucial to pay attention to your body and seek medical help if something doesn't feel right. Recognizing these symptoms is crucial for timely treatment. Speaking of which, so you've got a UTI. What happens next? Well, the first line of defense in treating a urinary tract infection or UTI is often a course of antibiotics. Antibiotics are generally effective in wiping out the bacteria causing the UTI. The type of antibiotic used and the duration of treatment depend on several factors. These include your overall health status, the type of bacteria found in your urine, and the severity of your symptoms. Antibiotics like trimethoprim, nitrofurantoin, and fosfomycin are commonly used. It's crucial to take your medication exactly as prescribed by your healthcare provider, even if your symptoms improve before you've finished the course. Not completing the full course of antibiotics can lead to the infection returning or the bacteria becoming resistant to the medication. In addition to antibiotics, your doctor might also recommend a medication to relieve the pain and burning during urination. These medications, known as urinary analgesics, can be a real lifesaver while the antibiotics are doing their job. But remember, these are not a cure. They only soothe the symptoms. Now, while medications are working their magic, there's something you can do to aid your recovery. Drink plenty of water. Staying well hydrated can help flush the bacteria out of your system and speed up your recovery. Some studies have even suggested that increasing your daily water intake can reduce the risk of recurrent UTIs, especially for women. Remember, treating a UTI isn't just about getting rid of the symptoms. It's about addressing the root cause of the infection to prevent it from recurring. This might mean making some lifestyle changes, like urinating regularly and not holding it in, wiping from front to back after using the toilet, and avoiding irritating substances like douches and powders in the genital area. So with the right treatment, UTIs are usually easily managed. But wouldn't it be better to prevent them in the first place? Absolutely. And that's where we'll turn our attention next. Stay tuned to learn more about preventing urinary tract infections. How can we prevent UTIs from occurring? Now that's the million-dollar question, isn't it? Well, the good news is there are some simple steps you can take to significantly reduce your risk. The most straightforward measure would be to drink plenty of fluids. Our bodies are incredibly efficient machines, and water is its oil. It keeps everything running smoothly, including our urinary systems. By drinking lots of water, you're helping your body flush out toxins and bacteria, keeping your urinary tract clean and healthy. Next, urinate regularly. Try not to hold in urine for long periods. The longer urine stays in your bladder, the more time bacteria have to grow and potentially cause an infection. So don't be shy or put it off. When nature calls, answer. Another key tip is about personal hygiene, specifically how you clean yourself after using the toilet. Always wipe from front to back after urinating. This simple action can prevent bacteria from the anal area, like E. coli, from spreading to the urethra. Remember, it's the journey of these bacteria from the anus to the urethra that often leads to UTIs. And here's another tip. Avoid using irritating feminine products. The use of deodorant sprays or other feminine products, such as douches and powders in the genital area, can irritate the urethra. For those of you who are sexually active, urinate before and after sexual activity. This can help flush out any bacteria that may have entered the urethra during intercourse. And finally, wearing cotton underwear and loose-fitting clothes can help keep the area around the urethra dry. Bacteria thrive in moist environments, so keeping that area dry can help prevent bacterial growth. These measures may seem basic, yet they are incredibly effective. Prevention is always better than cure, and taking these steps can save you from the discomfort and potential complications of a UTI. With these measures, you can significantly reduce your risk of getting a UTI. That brings us to the end of our discussion on urinary tract infections. We've journeyed through a comprehensive exploration of this common condition. We've understood that UTIs are infections that affect any part of the urinary system, often brought on by bacteria entering the urinary tract. We've learned to recognize the telltale signs: the frequent urge to urinate, discomfort during urination, and lower abdominal pain. We've also delved into the key risk factors, including sexual activity, certain types of birth control, and a weakened immune system. We've discovered the various treatment options, such as antibiotics and pain relief, and the importance of proper management to prevent complications. Most importantly, we've emphasized the role of prevention through steps like drinking plenty of fluids, urinating regularly, and maintaining good hygiene. Remember, knowledge is the first step to prevention. Stay informed, stay healthy.